Well, let's follow up on the debate over a National Pharmacare Plan. Pauline Worsfold is the chair of the Canadian Health Coalition. She's one of the more than 100 healthcare advocates on Parliament Hill to press for a National Pharmacare Plan. As you can see, she's with me now. Good to see you. Thanks for coming in to speak with me.
Thanks for
Let's start
having
with the timing. The debate's ongoing in this country about a National Pharmacare Plan. We're still waiting a report from the Prime Minister's Advisory Committee Council on how the government should proceed. So tell me about the timing. Why now? Why are you here to press for this?
Well, it's not a new file. We've been, the Nurses of Canada, Canadian Federation of Nurses Unions, have been working on this file for 2 decades. And so it's time. The time is now. With an election looming, I think the timing is perfect for us to be here on the Hill and meeting with MPs to pitch how they can do it. Because the advisory committee is on the implementation of a Pharmacare program. It's not whether or not we should have it. I think that debate is done. What we need to do is decide how we're going to implement it for everybody living in Canada.
And what's the view of your organization about how we should implement it?
So it's not too far reaching. It's based on the same principles as the Canada Health Act, that it needs to be comprehensive, it needs to be accessible, portable, it needs to be public single payer, and the administration has to be public, and it has to be comprehensive. So those are the 5 principles.
Okay. Now, we talked about this, I mentioned this committee, Dr. Eric Hoskins, former health minister in Ontario, who's been leading this study for over a year now, is supposed to come out with the recommendations and findings this spring, and no later than this spring. And a lot of people are thinking that what he might do is come out and say, look, the way to do this is for the government to provide healthcare prescription drug coverage for Canadians who don't have it in the workplace. So that wouldn't be a universal plan. What if that's what's being proposed? Is that acceptable?
No.
How come?
Absolutely not. A fill-in-the-gaps model is just not acceptable.
Why not?
The funding, it would just not cover enough people. It would not be comprehensive. And let's face it, putting the next jewel in the crown of the healthcare that we all so desire and uphold as something that is totally Canadian for us is not a stopgap measure. We need to fill in the gaps. And it would actually save money in the end. It would cover everybody in Canada and it would save money. The fill in the gaps model, that's not on.
How would it save money? Let's talk about that. I mean, there's some people talk about the bulk buying powers that a national plan would have, but currently a lot of people pay for their prescription drugs through health plans that they have in their workplace, and most Canadians have coverage, but there are a lot of Canadians who don't. So, isn't it just a transfer? So if I don't pay for it in premiums in my workplace, I'll pay for it in taxes, won't I, for a national plan?
No, taxes don't need to be increased. In fact, employers would save $9 billion. And because the plan that's provided, the employers usually pay a portion of it. The employers would save $9 billion, and the savings for households would be $7.1 billion. And the cost to set up a national public drug plan, Pharmacare, for every person that lives in Canada would be 2 to 2.6% of the budget. That's it, 2%.
Who would you... there are a lot of people that have concerns about the federal government getting into yet another delivery system. We've seen the troubles the federal government's had with the Phoenix payroll system. There's lots of concerns about how they deliver benefits for veterans in this country. A lot of people are suggesting that the federal government's not the best way to is not the best organization, if I can put it that way, to deliver a national Pharmacare plan. If that's what we're getting, what are your thoughts on that?
Well, they're the best ones to do it. It's publicly administered. The cost savings of getting rid of the plans, there's 100,000 different drug plans in this country. 100,000. And the administrative costs around those 100,000 plans is mind-blowing, I would say. So I think the best cost-effective method to implement a Pharmacare plan is the federal government. And we would have to have a standalone group of experts that would base the drug formulary on evidence and efficacy of the drugs. And as a registered nurse for 37 years, I totally support that.
So tell me what you've seen as a registered nurse for all these years. What do you seen? What do you see as the practical failings in the plan we have now with patients? What's being missed here when it comes to making sure that the Canadians who need prescription drugs get them?
I'm glad you asked. As a registered nurse, I do bear witness to some horrific things. A young man who a few years ago was a oil field worker who has lost his job in the province of Alberta. He stopped taking his ulcer medication because he couldn't afford it. A few months later, ends up in the emergency department with a perforated ulcer, had to go through the emergency department, emergency surgery, ended up in the ICU, and then on the post-op ward, and who knows what happened to him after he left the hospital, all for the sake of less than $800. If he would have had access to that ulcer medication over the 3 months that he didn't take it, it would have been a cost of $800 rather than a cost of all the hospitalization and the specialized services that that young man required. That's an extreme story, but there are a lot of those stories.
Okay, so the message to parliamentarians that you're meeting with today, and this will be an election issue. It's been promised before by different parties, still don't have it. What's your message to the parliamentarians now? As you mentioned, we're in an election year with an election 9 months away.
The message is we want Pharmacare now. We want it based on the 5 principles. We want it implemented across the country comprehensively, and will cover everybody living in Canada. And the time is now. We've talked about it. We've debated it. We have research papers. We have evidence to support that it's in the best interest of society as a whole and the healthcare system specifically to have a national public drug plan. We're the only country that has a national Medicare system that doesn't cover drugs. So the time is now. And the MPs, every one of them in the House, it doesn't matter, it crosses party lines, and it is the right thing to do, and will be their legacy as a sitting MP to implement a national Pharmacare program.
Okay, we'll watch and see how this will be an election issue. We expect to be talking a lot about it in the months ahead. But Pauline Worsfold, thanks for your time today.
Thank you for having me.